Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Gross motor milestones. In gross motor milestones, first we have head control. The first sign of head control is at 6 weeks. Then we have partial head control or neck control. Partial head control or neck control is seen at around 3 months. Okay, normal head control, the first sign is at around 6 weeks, and partial head control or neck control is around 3 months, and complete head control or neck control is around 5 months. Gross motor milestones. Then sitting. In the sitting with support by 5 months, sitting in tripod position by 6 months, sitting without support by 7 to 8 months of age. Crawling. In crawling, the child on head and knees, the child on hands and knees and abdomen in contact with the surface. So crawling by 8 months, and creeping where the child is on hands and knees and abdomen is not in contact with surface. So creeping is done by 10 months. The child creeps upstairs by 15 months. The child rolls in 4 to 6 months, and the child stands with support in 9 months, and the child stands without support in 12 months. The child walks or cruises with support in 10 to 11 months. The child climbs upstairs by 2 years. The child climbs upstairs by 2 years, one step at a time, and the child climbs upstairs and downstairs by alternate foot per step by 4 years of age. The child hops on one feet for 4 years. The child hops on one feet by 4 years of age, and the child skips on both the feet by 5 years of age. Fine motor milestones.
thank you and thank you for watching.